Hi, I'm Laura Cole, the Director for Communications and Public Information for Escambia County, and thank you for joining us for this edition of We Are Escambia. Today, I am joined with EMS Manager Jimmy Maddrey. Thanks for being here. And we are filming this during the situation with COVID-19, so that is why we were standing about 6 feet apart. And starting with that, Jimmy, can you explain to the public some of the measures we've been taking and what happens for paramedics and EMTs in this situation that we're experiencing right now?
Well, obviously it's a pandemic, and it has a lot of the community and citizens very worried. We as an EMS agency are on the front lines. You know, someone calls 911, we don't have the luxury of not responding, whether it be a true trauma or a medical emergency, or someone who's experiencing symptoms of what they feel may be the COVID-19. So all of our personnel have been trained. You know, we've given them classes on what coronavirus is, what it does to the system, what to look for in patients, certain questions to ask. All of our employees are wearing all the appropriate PPE when they encounter these types of patients. And what I mean by PPE is personal protective equipment, ranging from the rubber gloves, the medical gloves, to N95 respirators, to face shields, to some medical suits to keep the barriers between them and the patient. Every one of our employees has been N95 fit tested.
I'm fairly new to the county, and I remember meeting you in person, unfortunately, I'm glad we met, but it was unfortunate that I met you after the NAS shooting.
Correct.
Can you explain what it was like that day for you and what you had done to prepare the department for an active shooter, and also what you've done after that experience?
So, speaking of the day that you asked about, just a normal, ordinary day is normal. Crews were doing the exact same thing they always do every day, coming into work, hiding their musters in the morning, you know, find out what's going on for the day. Actually, I came into work early that day to get some stuff done in the office when the initial call came out as a shooter on base. As the information progressed, we knew that we had a serious situation. So all the people that needed to respond to the scene did. It was a horrific event, obviously. But going to the call, you know, you start playing in your head the things that you've been trained to do over the years of, you know, setting up incident command, triaging where appropriate, putting people in positions to triage patients. We were very fortunate, and we always are here in Escambia County, to have different agencies that we work with and train together. Sheriff's Department, Escambia County Fire Department, NAS Fire, even the City Fire and City PD. Prior to this event, you know, there have been active shooter mock disaster drills held at several locations, high schools, hospitals, courthouses, to kind of better prepare us. In my opinion, you can never be over-prepared. You need to always prepare and educate yourself even further, so anytime an incident like that happens, you're even more well prepared, working with the hospitals. That day in general, everything to me that we had trained up to that point went smooth. The men and women that provided medical service or medical treatment to the injured that day did a phenomenal job. I honestly think, and I actually know after speaking to several physicians that were involved, the death toll actually would have been much higher had the training not been put into place of placing tourniquets, applying pressure to where it needed to be. Unfortunately, we did lose some people that day, but it could have been a lot worse. Since that day, I have implemented that every single apparatus in the Escambia County Emergency Medical Service carries an active shooter kit. It's a condensed version of what we used to carry. The supervisors only used to carry a large bag full of active shooter equipment that would be needed to treat patients. Tourniquets, gauze, bandages, chest seals. These are very pieces of equipment that are needed to save the life of someone who's been injured in a shooting of such. So I got to thinking, you know, what we can do to better prepare us and the community. And that was to put one of these kits on every apparatus, because a supervisor may not be the first on scene. So we've implemented that, and we put together a smaller version. Still carries the same type of equipment, just not as much for a two-person crew. And we've actually, what inspired it was the NAS shooting, so to pay tribute to those that lost their lives that day, we've actually put a salute to the NAS event on the side of that bag.
That patch,
the patch
that we've seen. That's wonderful. You're doing such great work for the community, and I want to thank you for that.
Yes, ma'am.
You've gotten some other tools to help you do your job.
Yeah.
Tell me about the pediatric kit that you have.
Okay.
I know it has a better name than that.
It does. It's called the Handtevy Pediatric Resuscitation System, is what we'll call it. And basically, whenever you have a pediatric emergency, a medical emergency, or even a traumatic injury, pediatrics are kind of unique in some aspects. All the medications that are required to use on a pediatric are weight-based. So, you know, and you don't run a lot of those calls. And I kind of use an old saying I used to use in the fire department: if you don't use it, you lose it. Pediatrics are some of the same way. Is you don't run a lot of those calls, so unless you train on it on a regular basis, you may lose some of your knowledge or your skill set. So what can you put into place to help us out in case someone has a pediatric emergency? Because in a pediatric emergency, a pediatric does not, whenever they're going downhill per se, they really go downhill. They crash very fast. So we need to do our stuff in a timely manner. So the Handtevy Resuscitation System is set up to where it takes all the thinking out of us as far as drug dosages. We have an app that the Handtevy system put on our iPhones or an Android phone. When you hit this app, it pulls up a screen, and you can actually tap on the age of the patient, and it pulls up all the medications you would need for, say, a cardiac arrest, anaphylactic shock, and it gives you the exact drug dosages of what you need. And what we actually carry at Escambia, it's actually unique to our department. They follow our protocols. So you just hit certain buttons, and it takes the thinking of what to draw up, how much to draw up, and that's all that can be time consuming. So this takes all that time away. It tells you the doses to use, what size equipment as far as intubation tubes to use on a patient. So it's only beneficial to someone's family loved one that we have this system now that it can actually and will save lives.
Tell us a little bit about the ambulances, the new ambulances
Right.
that we got, how many, and what some of the features are that will benefit you as well as the patients.
Absolutely. So we're very fortunate this year to have the county commissioners allow us to purchase 3 brand new ambulances. And these ambulances to me are state of the art. I've been in other departments, so I know how lucky and how fortunate we are here in Escambia County to have the very equipment that we use. Like you said, injuries, it doesn't just stop at the injury, because if you have an EMT or paramedic who suffers a back injury from lifting patients all day long, it takes them out of work, which puts strain on insurance and workers' comp, paying people overtime to come in and fill that position. So from a financial management standpoint, it can be a strain on a department. So what do you do? What do you put into place to try to take those numbers or decrease those numbers? Well, you get better equipment. We have power load stretcher systems that are rated up to 750 pounds. That means, and our stretchers are actually battery operated to go up and down. So there's no more pulling levers and lowering with your legs and your back. You can actually push a button and the stretcher will go down. You can push another button and it'll come up. The power load system is you just push the stretcher in an up position so you're not bending over onto these lift bars. It locks in place. You hit a button, it lifts the stretcher up in the air, and you just lightly push it in. You can actually push it in with just 2 fingers. It's awesome. And they're rated for 750-pound patients. Also on these ambulances, they made sure that everything in the back was met specifications for a crash test. Horton, who is at top of the line crash ratings, things that hold our oxygen systems in place, things that hold our suction canisters, our life pack monitors, are all rated at high crash levels. That way, if something was ever happen in the back of the truck, it flip over, get in a bad wreck. These things are designed to stay in place and not throw around in the back of the ambulance. They're also curtained with safety restraint system, airbag deployments, and unique locations. So if something was to happen in that back of the truck, it almost throws up a giant pillow all the way around to keep you safe from getting thrown around. One thing I really like is the 4-point restraint system. At every point in the back of that truck where a paramedic or EMT may be working, there's a harness system that they can put in place, and it's just like a seat belt, but it's a harness. The unique thing about this is no matter where you're sitting in the truck that you can put this on, it still gives you the ability to stand up and move around to grab things, work on a patient. And if something was to happen, it's going to pull you back and keep you in a seated position. So, if something tragic was to happen and the ambulance was to flip over, you're not going to be thrown around, you're going to be stationary, which would cause less injury to my guys. So I'm very excited about that.
So you're making some really great changes and positive progress for the department. Are you hiring? What would you say to anybody who's looking to do your type of work, any EMTs or paramedic type of work?
I would say anybody who wants to be involved in emergency medicine, being someone who's worked at different departments, different states, this is a great place to come work and get great experience. We have some really good personnel here who like to train, who like to educate, who really take time to teach new people how to do their job and be efficient at it. We do have a young supervising staff. I'm looking for great things to happen in the future. They're going to give us some tenure here in the county and be here for a lot of years to come.
Is there anything else you'd like to add? Anything you'd like to tell the public?
I'd just like the public to know that with the guys and girls we have working here in Escambia County, that you are very fortunate to have the guys that I call my family taking care of your loved ones. They care about you, they care about themselves, and they care about their job. And you should just know that you're well protected here in Escambia County.
Thank you so much, Jimmy, for sharing your expertise. And it's my pleasure to be able to show off the great work that our EMS department is doing. And make sure you continue to follow all the great stories we're going to continue to tell about the progress that Jimmy Maddrey, he's leading such an excellent department with such fine men and women. And on behalf of the county, we thank you for all that you do. Thank you for keeping us safe.